Coming off steroids feels like hitting a wall. The low energy, bad moods, and lost gains are real. The frightening truth? For some, this hormonal shutdown can become permanent, requiring lifelong TRT. However, for many men, a full recovery is possible, often happening within 3 to 12 months. The difference between permanent damage and a successful recovery isn't chance. It's a specific plan. We will now break down that exact roadmap. The medical tools, the lifestyle factors, and the real timelines. So, what's actually happening? Your body's own testosterone production line has been ordered to shut down. This system, the HPTA, is a feedback loop from brain to gonads. When it's silent, you get the crash. The objective is not to replace testosterone forever, but to reboot that dormant production system. This is accomplished with a strategy called post-cycle therapy, which uses specific medications. The primary tools are SERMs, like Clomid. They work in the brain, blocking estrogen's off signal. By blocking that feedback, the pituitary starts sending LH and FSH signals again, telling the testes to wake up. But what if the testes have been dormant so long they don't respond? This is where a second drug, HCG, is used. HCG acts like the body's own LH signal, directly telling the testes to produce testosterone and restore size. Using these drugs is a delicate balance. The wrong dose or timing can worsen the shutdown. This is not guesswork. How you feel is not a reliable metric. Only regular blood tests show if the protocol is actually working. So you have the medical toolkit to restart the hormonal engine. But is that enough to drive away smoothly? The answer is no. Your body cannot rebuild its hormonal axis in a stressful, nutrient-deficient state. First, food. You must eat at or above maintenance calories. A deficit starves hormone production. Second, sleep. A significant pulse of testosterone is produced during deep sleep. Get 7 to 8 hours. Third, body fat. Abdominal fat is an estrogen factory, converting your testosterone and working against you. So, PCT drugs restart the signal, but these lifestyle factors ensure your body can respond to that signal. Even when doing everything right, this process takes time. What does a realistic recovery timeline look like? For most, testosterone can return to a normal range within 3 to 12 months. The brain signals recover faster. Fertility, however, is much slower. Sperm production can take many months, sometimes over a year, to restart. And recovery doesn't always mean a full return to baseline. Some men settle in a permanent low normal range. The biggest predictor of your outcome is the duration and dosage of your steroid use. Longer means harder, and some physical changes are permanent. While testicular atrophy can reverse, gynecomastia will not. Let's connect this. PCT can restart the HPTA, but its success is tied to how long that system was offline. Because timelines are so variable, blood work is non-negotiable. It's the only way to track progress accurately. And this medical intervention is built on a lifestyle foundation. Diet and sleep turn partial recovery into full. Recall the psychological crash? A medically guided plan doesn't just fix hormones, it clears the mental fog. Recovery from prolonged steroid use is a complex but manageable process. It is not just taking a few pills. Success rests on 3 pillars: targeted medical intervention, a supportive lifestyle, and data-driven guidance. The risks of getting this wrong are severe, from poor recovery to permanent hormonal dependence. Do not go it alone. Your long-term health is at stake. Take command of your recovery by making the smart choice to get expert help.